Lion's mane mushroom is a nootropic food very popular in traditional Chinese medicine. One study, published in the Journal of Agriculture and Food Chemistry, lists the benefits by stating lion's mane mushroom is antibiotic, anti-carcinogenic, anti-diabetic, anti-fatigue, anti-hypertensive, anti-hyperlipidemic, anti-senescent or anti-aging, cardioprotective, hepatoprotective, nephron protective, and neuroprotective, and it also improves anxiety, cognitive function, and depression. Lion's mane is native to North America, Europe, and Asia, although it's not cultivated widely in areas outside of Asia. These mushrooms grow on both living and dead broadleaf trees, and they're common in the late summer and fall months. Research shows that lion's mane possesses anti-inflammatory, antioxidant, and immune-stimulating properties in cells of animals and humans. It's been used for thousands of years as a medicinal mushroom, especially among traditional Chinese medicine practitioners. The most thoroughly researched feature of lion's mane mushroom is its impact on brain cells and related functions. This incredible fungus may have revolutionary impact on neurodegenerative diseases. One method by which lion's mane affects brain function is by enhancing neurite growth in the brain and related organs. This is according to research published in the International Journal of Medicinal Mushrooms. Neurite outgrowth refers to the growth of axons and dendrites from neurons. This is a big deal in brain health research. By increasing their growth, it could potentially be possible to slow or reverse cell degradation in the brain, which is the main characteristic of diseases like Alzheimer's and Parkinson's. A 2012 study conducted in Malaysia found that consuming lion's mane mushroom could actually regenerate damaged cells from peripheral nerve injury, an injury affecting the delicate tissues between your brain and your spinal cord. When studying how brain diseases might be affected by particular medications or treatments, scientists often use what's known as a PC12 cell line for the testing. Extracts and various forms of lion's mane mushroom seem to have a major impact on PC12 cells, protecting them from damage and delaying their cell death significantly. This finding may prove to be extremely relevant for preventing and treating certain brain conditions. In animal research published in Evidence-Based Complementary and Alternative Medicine, lion's mane mushroom stimulated cognitive function and helped to improve memory in mice, both with and without Alzheimer's model. Multiple studies have found an inverse correlation between lion's mane and Alzheimer's-related symptoms, meaning that after consuming the mushroom extract, the mice's symptoms improved. An improvement of mild cognitive impairment in humans was also found in research published in Phytotherapy Research after 8 to 16 weeks of lion's mane supplementation. Although this improvement did not last after the subjects stopped taking the supplement. The danger of ischemic injury, which is damage caused by a lack of blood flow to neurons, is also of significance when talking about brain damage and disease. In lab tests conducted in Taiwan, lion's mane mushroom has been shown to help prevent this type of injury. Taking lion's mane supplements has also been found to have potentially protective effects on the spread of Parkinson's disease, which is another neurodegenerative disorder, according to animal research published in the Journal of Translation Medicine. Lion's mane may also be significant in helping treat cancer, according to a host of research in varying degrees. Compounds from or supplementation with lion's mane mushroom has been found to potentially slow the progression or reverse the spread of leukemia, gastric cancer, lung cancer, cervical, liver, colon, and breast cancer. In regards to leukemia, lion's mane was shown to significantly reduce leukemia cells in a Korean study. Further Korean research conducted by the Department of Molecular Science and Technology at Aozhou University found that thanks to the phytochemicals in lion's mane mushroom, it has therapeutic potential against human leukemia. As far as gastric cancer is concerned, a study published in the International Journal of Biological Macromolecules found that lion's mane caused cell death and cell cycle arrest with gastric cancer. The researchers concluded their study provides in vitro evidence that the HEG extract may be taken as a potential candidate for treating gastric cancer. Both cell and animal studies published in the Journal of Natural Products and Kaohsiung Journal of Medical Sciences unearthed the ability of lion's mane mushroom to help treat lung cancer. Meanwhile, according to in vitro and animal research published in the Journal of Biomedicine and Biotechnology and the Journal of Ethnopharmacology, lion's mane exhibits anti-cancer activity against colon, breast, and other cancers. Some studies actually suggest the use of lion's mane mushroom supplements to treat cancer, although long-term and large-scale studies have not yet been conducted. Another interesting finding involved the metastases, or the cancer spreading from the colon to the lung. When a cancer spreads to more than the original organ in which it was found, a patient is considered to have stage 4 cancer. In a study conducted on rats out of Korea, the rats were given either hot water lion's mane extract or a microwaved alcohol extract of lion's mane mushroom. By consuming lion's mane extract, the rat studies showed an inhibited metastases of the cancer cells to the lungs by 66% and 69% respectively. Lion's mane mushroom may also help in preventing heart disease. In vitro and animal research has found that extracts of lion's mane mushroom can prevent the increase of LDL cholesterol, sometimes referred to as bad cholesterol, increase HDL or good cholesterol, and lower triglyceride levels in the bloodstream. All of these are an early indicator of heart disease. An extract of lion's mane mushroom may also be able to prevent blood clots and help to reduce the risk of strokes, according to a study conducted in rabbit blood platelets. Due in part to its powerful anti-inflammatory properties, lion's mane mushroom might improve the function of your stomach and the digestive system. In multiple studies, lion's mane mushroom has been shown to protect from or shrink gastric ulcers. For instance, according to a study conducted on rats by the Mushroom Research Centre in Malaysia, the research concluded that the bioactive compounds in lion's mane extract may be responsible for the gastroprotective activity that was exhibited on the rats. Research on mice from China, published in the International Journal of Medicinal Mushrooms, confirms this, noting that results indicate that the polysaccharide fraction is the active component of the lion's mane mushroom culture, which protects against gastric ulcers. Lion's mane may also significantly improve symptoms of two major inflammatory disorders of the digestive system, gastritis and inflammatory bowel disease, as was shown in lab studies and research on mice. A 2015 study out of Japan found that lion's mane mushroom was able to reduce inflammation in fatty tissue. This is important because fatty tissue inflammation is a factor in the formation of metabolic syndrome, a cluster of conditions that increases your risk of heart disease, stroke, and diabetes. Lion's mane also has antibacterial effects against Helicobacter pylori, which is often considered the most successful pathogen in human history. Many people never have symptoms of carrying the bacteria, but for some people it causes severe gastric conditions like ulcers in the stomach and/or the intestines. The molecules in lion's mane mushroom have antioxidant abilities and help to prevent and relieve the oxidative stress caused by poor nutrition and exposure to chemicals in the environment. One specific way these antioxidants may be useful is the healing of wounds. A study at the University of Malaya found that a liquid extract of lion's mane sped up wound healing significantly compared to natural healing in rats. These antioxidants may also help prevent osteoporosis, protect against alcohol-induced liver damage, and slow the aging of skin, as was displayed in a study on rats. A lion's mane mushroom supplement may also help you feel better by improving sleep and reducing the effects of mental health issues. The powerful polysaccharides extracted from lion's mane have been shown to fight fatigue in mice trials. They also might have the ability to adjust circadian rhythms back to normal, as they did in a mice study conducted at the Department of Agro-Environmental Sciences. This is particularly significant for people who are at risk of dementia. Consuming lion's mane mushroom may also be a natural way to help treat depression and anxiety. In one study, 30 women were given either a placebo or lion's mane mushroom for 4 weeks. Researchers concluded the results show that the lion's mane intake has the possibility to reduce depression and anxiety, and these results suggest a different mechanism from the nerve growth factor enhancing action of the lion's mane. This seems to be related in part to the inflammation factor that is found in depression, as was shown in mice studies. Lion's mane seems to have the ability to enhance the immune system's function in a manner also related to the polysaccharide content in the mushroom, according to research performed on mice. A 2013 animal study showed a marked improvement in blood glucose levels, insulin sensitivity, and various other diabetes symptoms when an extract of lion's mane mushroom was given to them. Possibly because of the antioxidant activity of the lion's mane, administering it to animals also seems to relieve pain that's caused by diabetic neuropathy.